Hi everybody, happy Tuesday. I'm Dr. Rachel and I am at the West Des Moines office today, and I wanted to share with you 3 exercises that I use with my clients who are going through breast cancer treatment, whether it be chemotherapy, radiation, lumpectomy or mastectomy. And these exercises really focus on regaining mobility and improving posture. Those are things that are commonly really affected when we go through treatment. So with these exercises, it's important to note that if you've had surgery, you need to be cleared by your medical team to do movement. They are not on any movement precautions. So these are things that I just use with my clients, but always consult with your medical team before doing any of these. So the 3 exercises, like I said, they focus on mobility and posture. The first one is just going to help with some overhead reaching. The second one is going to help with some reaching behind your back. And the third one is just going to help open up the chest and shoulders a little bit. So for the first one, you'll need something at home that's lightweight. So usually like a Swiffer, a broomstick, golf club. I have a walking stick, but it should be pretty lightweight because we're going to lie down and use this to help us reach overhead. So move over to my table. And for this first one, you're going to lie down on your back and you're going to grab your lightweight stick, and you can start with your palms facing down, or you can do palms facing up. Either one is fine for this, but I'm going to do a palms facing down. So arms are going to be straight, and this we're working on that overhead reaching. So you're grabbing the cane, and you're just very slowly going to raise it up towards the sky, and we're trying to get into the overhead range, but this might feel tight when we start out. So if you can't reach all the way overhead, that's okay. Go to a point where you feel a little bit of a stretch, and then bring it back down. And we're going to try to do this one 5 to 10 times, each time kind of focusing on that point where you feel a little bit of a stretch, but you're not feeling any pain or discomfort. I think another important thing with this one is to make sure that you're breathing. So taking those belly breath, back breath, expanding through the ribs as we inhale and reach over, and then exhale on the way down. We definitely shouldn't be holding our breath for these exercises. And that's our first one. Our second one that can be helpful for reaching behind the head and the neck and shoulders. So itching that scratch in the back, maybe putting on a necklace or anything where we kind of reach behind our head. So for this one, what we're going to do is bring your hands to your neck and your elbows are in front of you. And with this movement, we're going to take a breath in, and we're just going to expand those elbows out to the side. So bringing your elbows away from each other. And then you can bring them back in as you exhale. Thinking again, nice tall posture. I don't want you to be slumped as you're doing this one. So we want to make sure we're sitting up nice and tall. And take that breath in. Fill the belly, the back, and the ribs full of air. Bring those elbows out, and then exhale and then bring them back in together. Same thing for this one. You shouldn't have any sharp pain or discomfort. You should just feel really a stretch through the front of the shoulders, and that's helping get that mobility behind our back. The third one we have, I'm going to switch the camera around, is a pec stretch. So you can do this in a doorway or in a corner. A corner is a little bit lower intensity than a doorway, but you can really moderate how much of a stretch you get by how deeply you sink forward. So what we're going to do is we're going to put our arms on the corners of the wall, one foot in front of the other, and then you're just gently going to sink your chest forward into the wall. You should feel a stretch across the front part of your chest. And again, focusing on your breathing as you're doing this. So one foot in front of the other. This is going to get the middle portion of those pec muscles. We can also get a little bit more of the lower part of our pec if we just bring those arms up a little bit. So same idea, one foot in front of the other, and we're sinking forward, but our arms are just a little bit higher. And that gets our different portions of our pec muscle to stretch and relax. So that one, again, try and breathe through it. Make sure you're not holding your breath. Ideally, trying to go up to about 30 seconds for that stretch, but if it feels uncomfortable, you can sink out of it, give yourself a little bit of a break. So those are 3 common exercises that focus on mobility that I use with my clients. They can really be helpful for regaining that shoulder motion, helping with our posture, for breathing, and they can help with just overall flexibility. So 3 things I do with my clients, but also, like I said in the beginning, check with your medical team to make sure you're not on any movement restrictions. If you have any questions, feel free to contact our office at email, or you can give us a phone call, and we'd be happy to talk with you or schedule an appointment with one of our therapists. I hope you all have a great Tuesday, and thanks for tuning in. Have a great rest of your day.